valve prosthesis that we use for valve replacement, essentially we use it for aortic and mitral. So for these two valves, we usually commonly perform a procedure of aortic valve replacement and mitral valve replacements. And these valves are replaced with prosthetic valves. These prosthetic valves are of two types: mechanical valve and biological valve or bioprosthetic valve. During our course of discussion, we will be seeing the advantages and disadvantages of each. We will start with the mechanical valve. So the mechanical valves are those valves bioengineered with synthetic components There are three important parts of a valve. One, the disc of the valve. Second, the housing of the valve. And third, the sewing ring. Based on these three parameters, we classify the heart valves into two. One is monoleaflets and bileaflets. We'll discuss about the two types. Overall, let us discuss the advantages of these. General advantage is that being synthetic, these components are of very high durability. They can last more than 20 to 30 years altogether. Second, they have a very stable hemodynamics, offering better orifice area, effective orifice area, and hemodynamic stability in the patients. Preferred more often in younger patients who are mobile and are compliant with medications. So the advantages of mechanical valves: durability, (20 to 30 years), good hemodynamics, third one, best suited for young adults. Ideally, the cutoff being 50 years of age. However, certain mandates for mechanical valves are lifelong anticoagulation. Patient must be on vitamin K antagonists, which are warfarin, coumadin. So these are vitamin K antagonists or VKAs. Patient will be on lifelong vitamin K antagonists to prevent thrombosis of the heart valves. So the third thing is that audible clicks. Patient will definitely hear audible clicks with each heartbeat. Issues of VKAs may affect for any surgical procedure during pregnancy, etc. These are certain disadvantages when it comes to our mechanical heart valves. Coming to the major two types of mechanical heart valves, what we discuss is single leaflet valve and double leaflet valve. Single leaflet valve. So single leaflet valves, advantages of single leaflet valves is that it is of single disc, much better than what it was, much better profile compared to the previous older outdated ball and cage valve. It is pretty simple, yet robust technology. Of course, it requires vitamin K antagonists. One important thing about this, what we use currently is TTK Chitra valve. So this was the only Indian origin valve that we have, and it is currently still in use, most economical. It has gone through generations of modifications and has come to an arrival at this stage, which has been giving great results so far. Introduced by Dr. Valiathan, phenomenal cardiac surgeons as well as a biomedical engineer to have developed such a valve. So this was single leaflet valve. The other one that we use currently are bileaflet valves. These are the only two mechanical valves that we are currently using. Bileaflet valves, the difference being there are two discs here, two discs at the center. Best hemodynamic flow. Again, best effective orifice area for the blood flow of the valve. Long lasting again. The newer generation valves, because of their better coating, have been able to sustain with lower doses of vitamin K antagonist. So they have been able to sustain with lower doses of vitamin K antagonists. All over the world, it is widely used type of mechanical valve. The disadvantages are subtherapeutic doses of warfarin or vitamin K antagonist leads to thrombus formation, and that may occlude the functioning of the valve. One of the other advantages, especially in a very narrow annulus, is that bileaflet valve, even if one of the valve leaflet chokes, the other leaflet is functioning well while the patient can come and get some solution at the hospital. However, when you consider a monoleaflet valve, the moment this chamber chokes, it's actually a death statement for the patient. This essentially happens if the valve is stuck in a closed position. If the valve is stuck in an open position, then there is a free regurgitation. Even then, the patient has some time to come back to the hospital. So there are certain minor differences in advantages, disadvantages between the two. Overall, what is right now being used, widely used, is your bileaflet mechanical heart valve. Coming to the next other type of heart valve, which is bioprosthetic heart valve. So bioprosthetic, as the name suggests, is made up of xenogenic tissue. So made of xenogenic tissue. So what happens here is that the tissue could be obtained from one of the two animals. One is a porcine, which is pig. The other one is bovine, which is from the cow or cattle. So these are the two animals for which we are obtaining the tissue for bioprosthetic heart valves. Essentially what they have is again three parts. One valve leaflet, mounting frame, sewing ring. These are the three components. Based on the valve leaflets chosen, it is bovine or porcine. Two types of heart valves, bioprosthetic, that is of continuous use. So what we see as general advantages in patients with bioprosthetic valve. First thing, they do not require any vitamin K antagonists. No anticoagulation is required. Except for the first few months after surgery, where a low dose anticoagulation like 2 mg warfarin is somewhat subjected. Second advantage, best hemodynamic profile. Because it is almost physiologic. So it is almost physiologic. Third thing, because there is no anticoagulation required, no risk of bleeding. The only disadvantages what we are going to speak about is that early structural degeneration. All the valves that are in the market can give up to a lifetime period of 10 to 15 years maximum. After 15 years, every biological valve is going to have structural degeneration, and the durability of the valve is not as high as mechanical valve. Second thing, the higher lifetime, you have a reoperation risk. Very high reoperation risk in biological valves. So this is what is in general what biological valves offer as advantages and disadvantages. So coming to the porcine valve, now the porcine valves is made up of the aortic valve of the pig itself. The aortic valve of the pig closely resembles that of the human aortic valve, so as to have and maintain the same hemodynamic profile. The pig's heart valve, essentially the aortic valve, the valve leaflets are harvested to make a human valve counterpart. So essentially the aortic valve of the pig has 3 cusps which resembles exactly the aortic valve of the human counterpart: the right coronary cusp, the left coronary cusp, and the non-coronary cusp. The right coronary cusp, however, of the pig is attached to the interventricular septum, which means it has its own muscle attachment to it. Now, the moment we harvest the right coronary cusp and implant it to the human tissue, there is a definite vascular reaction, and this induces immunogenicity. So all we can use for making the heart valve is the left and the right, 2 valves, 2 valve leaflets to be precise. So in order to make 1 valve, you require at least 2 pigs. Gives us 4 leaflets, 3 leaflets utilized. So now you may understand why porcine valve are not much of use, because it takes a lot of pigs to make 1 valve. The advantage, however, is that it is physiological. The only advantage compared with mechanical valves, not really with respect to the bovine valves. Yeah, so this was about porcine bioprosthetic valves. Coming to the next one, the bovine bioprosthetic valves. Now, the bovine valves are made up of pericardium of cattle. So the pericardium is harvested. Now, given the big, huge pericardium, It is pretty easy to design the valves, multiple valves, varied sizes. So this was a possibility, and so engineering this pericardium into a competent valve was much more easier than considering that of the porcine valves. So what are the advantages of these compared to that of porcine? Varied size available, better hemodynamic profile, and then better survival as evidenced by many studies compared to porcine valve. So these are the advantages of bovine heart valves. All of these heart valves, both these heart valves, are subjected to one of the process called as glutaraldehyde fixation. Now this glutaraldehyde treatment is essential for heart valve fixation. Why? So the glutaraldehyde treatment is an essential part of formation of any valve. Why is that? Because the moment we treat the glutaraldehyde with any of the bioprosthetic valve leaflets, what is induced is that increases cross-linkage, increases cross-linking between the collagen fibers. This leads to the stiffening of valve. Increases competency and stiffening of the valve. It washes away any surface antigen on the pericardium or the valve leaflets of the porcine valve. The third one being disinfectant, a natural disinfectant along the process. The only disadvantage is that if there is induction of increased cross-linking, this leads to early calcification. Is one of the disadvantages of too much of glutaraldehyde treatment. So let us discuss the differences between bioprosthetic and mechanical valve prosthesis, and we'll see where what can be applied. When it comes to bioprosthesis, there is no need for lifelong anticoagulation. Patient can do without anticoagulation. Essentially, the first 3 months are of blanket warfarin dose that is not monitored under therapeutic dose, but then it is just given as a blanket dose. After that, the patient need not take any anticoagulation. There is low risk of bleeding because of the same reason why we don't use anticoagulation. Used in patients where contraindication for anticoagulation, where in situations like pregnancy, where vitamin K antagonist is harmful and teratogenic for the patient. Next, preferred in older patients, cancer patients, and renal failure and hemodialysis for the same reason as anticoagulations. Shorter durability, yes, because the valve is being used, the valve undergoes very early degeneration and calcification and tearing, and this leads to a shorter durability of the valve. When it is put in younger patients, there is a lot of reoperation risks. That is the disadvantage of bioprosthetic valve. Coming to the mechanical valve, the advantage being longer durability. The durability is close to 20 to 30 years as per studies and follow-ups, and due to which there is low reoperation rates. Coming to the hemodynamics, favorable hemodynamics, but not as much as that of the bioprosthetic valve that is coming right now in the market. Most preferred in younger patients because of the durability itself. What is the disadvantage? There is increased risk of thrombosis. There is a lifelong need for anticoagulation. Suppose the patient is not compliant with anticoagulation, very early risk of thrombosis is seen. Higher bleeding risk if the patient is overreaching the subtherapeutic dose of anticoagulation. So these are the advantages and disadvantages of mechanical and bioprosthetic heart valves.